Hello, my name is Jenny O'Neill, and I will be presenting this week on hemispatial neglect. Hemispatial neglect is also commonly known as hemiagnosia, hemi-neglect, unilateral visual inattention, spatial neglect, or just neglect syndrome in general. If you hear any of those descriptions, they're basically talking about hemispatial neglect. Just different doctors refer to it as different, but they basically all are talking about the same type of condition. So hemispatial neglect is considered to be a very complex condition. It's very hard to diagnose and very difficult to treat. Though as time goes on, things are getting a little bit easier compared to 10, 15, 20 years ago, but it's still very complex because of how broad it is. Hemispatial neglect is considered to be a heterogeneous disorder with many variations that include many different subtypes. So that obviously is a factor playing into how complex it is. We will be focusing directly on the whys and the hows a person might get this type of condition, and what the symptoms are, what the assessments are, and what currently the treatment is being used to determine the severity of it, as well as if the practices are working or not. Hemispatial neglect is a neuropsychological disorder or condition, in which after damage to one hemisphere of the brain, patients fail to attend to, respond to, or orient voluntarily to people or objects on the opposite side of space. So basically, in layman's terms, that a person will, if damage is sustained on one side of the brain, the patient will completely fail to acknowledge anything on the opposite side of their hemisphere. So though hemispatial neglect can affect either side, it is absolutely most common among brain injuries to the right cerebral hemisphere, and most frequently associated with the lesion of the right parietal lobe, causing visual neglect to the left side of space. So if we broke that down actually even further, which I will be able to show you some examples tomorrow, but it is more related to the damage to the temporoparietal junction and posterior parietal cortex. So that's generally in these types of cases that I have learned about, that is where the damage to the brain has taken place. As we know, our parietal lobe function is primarily in determining our spatial sense and navigation. This area of the brain seems to play a large role in representation of our personal space or body image or just body space, and the external space. More specifically, research shows or suggests that the posterior parietal area is responsible for spatial localization, directing attention during voluntary and tactile tasks, and for visual awareness. So it is believed that the area receives and integrates incoming sensory input and produces a spatial representation of the world relative to itself and how we look at it. So if I can just maybe dumb it down just a little bit, it's basically why we don't run into walls, and how we are able to see differentiate between shapes, between a cone or a stop sign or a traffic cone or driving. It's how we determine depth perception, etc. So this was so fascinating to learn about, because this is how they theorize why damage to the right hemisphere causes this more so than to the left, because the right hemisphere of the brain is specialized for everything we just talked about, basically spatial perception, including memory also, whereas the left hemisphere is specialized for language. So if a person's right side was damaged, they would lose the inability to have all of those senses, which is why they say that hemispatial neglect affects those people. So it typically occurs after a person has a stroke. At least 2/3 of stroke victims have been diagnosed, and they are often unaware that they have this condition. This is also fascinating and quite scary. People who suffer from hemispatial neglect don't realize that they have an issue because to them, the left side of their world, it isn't there. It does not exist. It's not there to them. Though their motor sensory is not necessarily damaged. So one might be able to see the left side, but their eyes don't navigate to the left side. It also has been talked about and a little bit controversial of where the left side begins, and most commonly among all the research that I did, it was saying that it was the midline of somebody's face. So for a person who suffered from hemispatial neglect, it would be if you split their face down the middle, their left side would start to the left of that line. So that's kind of interesting also. A number of strange symptoms are associated with hemispatial neglect, including the example from Ramachandran's book about the son whose mom came out of the bedroom and only had half of her makeup on. Her makeup was only done on the right side. That is a typical symptom. Another symptom might be only half of a face is shaved, or the entire right side of the body is the only thing shaved, where they leave the left side alone, or a person might only eat the food that's on the right side of their plate, no matter how hungry they are. It also talks about how a person fails to see or recognize any object or person coming from the left side. We actually are going to watch a video tomorrow of an older married couple who she is sitting on his left side, and he knows that she's there only because that she's made herself, or he made him aware that she's there, but he doesn't acknowledge that she's there or see that she's there. And it'll talk us through how she makes him aware that she is there. So it's very, very interesting. But as you would assume, it's a huge safety hazard for people not to be aware of things that are coming from the left side. So people who suffer from this disorder generally obviously don't go out unattended. Neglect can also be present as a delusional form, which means that a patient denies ownership of a limb, an attached limb, or an entire side of the body that could be functioning completely normal. That is considered to be an output motor sensory factor or description of neglect syndrome. So again, we will talk a little bit more about that as well, but it's very interesting that somebody whose limb is attached, they see it as they don't see it actually. They don't even recognize that it's there or that it's useful. Some assessments that are currently being used to assess the severity of neglect is something called the line bisection. And also the cancellation test, and both are papers used with drawings. For example, the line bisection, there is just horizontal lines drawn on a paper all over, and the patient is instructed to draw a midline on each of the line, and we will look at considered normal bisection, and then also a bisection of a person who is suffering from this disorder, and obviously they are very, very different. But treatment is a little bit tougher to talk about because it is right now is hard to find a treatment that works. Currently, the treatment strategies for hemispatial neglect have focused on training attention in the left hemispace, using a variety of techniques, including sensory awareness, visual scanning, and spatial organization. Recently, additionally, treatment strategies have emerged the focus on representational aspects of brain functioning. And the main focus of this type of treatment is consisting of ways to re-engage the right side of the brain by actively finding ways to bring the patient's attention towards the left. And they usually do it intermittently and by just going a few degrees and then working off of that. Other strategies have included visual and movement imagery, manipulation of sensory input that conveys perception, and the complex nature of visual input using prisms and eye patches. And actually, prism adaptation is something that is being used most often right now, and we will give an example of that as well tomorrow, but continued research will play a pivotal role in devising effective treatment strategies for patients with this condition because it has proven to be very difficult. So as you can see, there is a lot to talk about, and this is just one very small part of hemispatial neglect, but it basically gives you a background of who, what, when, and where, and why. And we look forward to discussing it more tomorrow, and hope everybody enjoys the presentation. Thank you.